Hi, my name's Jerry. I'm a professional therapist and coach, and welcome to my podcast, Who the Do You Think You Are? Now, today I'd like to share with you types of common therapy approaches that will give you a little bit of a flavour of what goes on in those therapy sessions and will help you along the way if you're looking for a therapist, because there are over 400 different types of what we call modalities. So choosing a therapist can be really overwhelming. So let's look together so you can have a better understanding of how it all works. So with so many different therapy approaches, it can be really difficult to understand which is the best one for you. And often we have different needs as well. So clients will assume that they'll be asked a series of questions, or perhaps they'll come away with some tools. I think having an understanding of the actual modality, so the approach that your therapist uses, can be really, really useful, especially if you're looking to unpick trauma, anxiety, grief. There's so many helpful ways that a therapist can help you that are not really well known about. So I really want to empower you to be able to make the choice and to ask the questions and to have an understanding of exactly what is going to be going on in your therapy sessions. So first of all, let's talk about CBT. So this is cognitive behavioural therapy. This is the traditional approach that helps people deal with negative thought patterns. You may have come across it because generally the GP will refer people on for CBT therapy or talking therapy. So CBT is really useful for people that are dealing with anxiety or depression because it challenges the negative thought patterns that we have. So CBT will help you collect data, as I say with clients, in terms of what are those negative thoughts? How are they showing up for you in your day-to-day life? And can you challenge those thoughts? CBT will give you tools that will enable you to apply a little bit more logic and help you to reframe those negative thoughts. I had CBT years ago and it was really helpful for health anxiety. What I found helpful was when the therapist explained our thoughts and asked me to picture a river with loads of fish going through the river, and actually the fish are the thoughts, but actually the aim of CBT is to just acknowledge that they're there but not get drawn into them. Another way of looking at it is imagine loads of clouds in the sky, and that's the mind, and you're watching the clouds kind of drift by. So the real aim of CBT is to be able to know that them thoughts are going to come up, but not get consumed by them. Because when we have a negative thought, it's then followed by an emotion and a physical reaction. So the tension and anxiety that you're feeling starts with the actual thought. And then we can start feeling, oh my God, I feel panicky. And then perhaps we have a kind of bodily sensation, so chest pain, tummy issues, or anything else that goes on for you at that time. So CBT helps you to improve your emotional response to a thought, a negative thought. And this can be helpful for people with social anxiety. You may have reoccurring thoughts of people don't like me, people are untrustworthy. And what we do in that scenario is we reframe the thought pattern around that. What would happen if you went and you enjoyed yourself? You know, start to lean in, as I say, to that logic that helps you really reframe them thoughts, which will then lead you on to having more positive experiences. Sometimes when we have these negative thoughts, we can go straight into what we call avoidance. And so it's almost like you don't even try these things because we know they're going to be stressful and we avoid. But in doing that, it's almost like we get smaller and smaller and smaller and smaller. So if you've got an idea of these negative thoughts, these really big thoughts that are going on for you, then CBT would be a great option to have a look at. Your therapist will generally also give you some worksheets to help you through the week in between sessions, identify when you're having the thoughts, and then give you some tools to help you reframe them. So there's a little bit of work outside of session. And if you put the work in, it can be really helpful. Next up is person-centered therapy. Now, this is the modality that I am what we call grounded in or classically trained in. And this is what we call non-directive. It's all about the relationship with the client. It's all about how we work through and navigate what's going on for you. So it can be quite conversational. There's a lot of listening on the therapist's behalf and a lot of reflecting back what you say. And the reason why this is super helpful is because talking out loud hits our brain in a different way. It really allows you to lean into your own logic. And you might have noticed if you have a friend that talks to you and they are telling you about a problem or an issue, you may well find if you don't interrupt and they carry on with the flow, you'll find them saying things like, my relationship's not working, he's done this, he's done that. However, I suppose he has done this and, well, he's not that bad. So being able to have that space of pondering without that jumping in with advice and without that kind of knocking you off course really helps you to self-reflect and also come to your own conclusion. Now, person-centered therapists work within a really beautiful set of conditions. So we offer what's called unconditional positive regard. So that is absolutely seeing you for the person that you are. We offer empathy and a lot of authenticity. And that is the secret sauce for me. Showing up as myself, being authentic. There is something about that space that allows that person to feel safe, secure, relaxed, and explore their own world. It's a really useful process to help you understand yourself, to understand what's going on with your inner workings, to navigate around why you feel in a certain way, and to just have a conversation that's all about you, because it's always all about you. Just unapologetically unpack and see what's going on. Personally, I start all of my sessions with clients in this way because it really allows the relationship, we call the therapeutic relationship, to really build. So eventually we may start moving into looking at things that can be done outside a session, but we always start with person-centered. The sessions don't generally follow on from each other. So one week you'll go in with a particular thought or something you want to work out. The sessions don't follow a set pattern. So if one week you're saying one thing, that's fine. The next week you'll say another. It's really common, and I did this with my therapist, to really talk about whatever's going on at the time. And over the course of the relationship and over the course of the sessions, you will start to connect dots, light bulb moments and everything else. But it's really about you developing real self-awareness and ultimately helping yourself. The aim of this is to help you become the best version of yourself. There can sometimes be long pauses in person-centered therapy, and that's where the therapist stays out of your way, because during those pauses, that's where we're like pondering, looking up, wondering, and often we don't jump in to save you at that point. We don't want to knock you off course. So if you're looking for more of a conversational exploration of yourself, then I would definitely recommend person-centered therapy. Next, we have psychodynamic. This is where the focus is primarily on past experiences and how it's affecting your behaviour. It's really rooted in the belief of those early childhood experiences and how they're showing up for you today and how they're getting in the way. It's looking at these early experiences, attachment styles and relationships at a real deep level to see how that has formed a part of our belief system in terms of who we are today. It's a really good way of identifying hidden thoughts about ourselves and those conditions that we've picked up that we don't really realise we've picked up. And by really understanding where those thoughts have originated from, so we can choose the story that we tell ourselves in the present. We can identify those experiences, but there's something about understanding the power of choice in the present day. And I found this really useful. Through looking at early childhood experiences, I was really able to pick up abandonment and rejection. And it wasn't that easy to spot, but actually, when we looked at attachment style, it made complete sense that rejection and abandonment shows up for me today. And that shows up in relationships, in everyday life, basically. But being aware of that and the work I've done on myself just means I can clock when it's getting in my way, and then I'm not avoiding things. I'm acknowledging that the past really shaped some thoughts of how I showed up in the world and my worth. Next, you've got EFT, emotionally focused therapy, and this is really useful. It's designed to strengthen bonds between people, whether they are couples, family, or friends, and it really helps you to understand and express your emotions, which ultimately allows for better relationships and real deeper connections. And it's really useful for couples that are looking to resolve conflict and enhance any intimacy. Next up is EMDR. EMDR is effective for things like PTSD and trauma. It stands for eye movement desensitization and reprocessing. This specialised therapy is specifically designed for people who are dealing with trauma, and this is done through guided eye movements where clients reprocess traumatic memories, which can significantly reduce the impact of that trauma and those experiences. So if you're not ready to go there and think about those traumatic events, perhaps EMDR isn't something you would start with, but you may consider after you've seen a person-centered therapist, for example. So it's really about those guided eye movements, revisiting that trauma and reprocessing. Next up is integrative therapy. So this is the camp I sit in, and this is where the therapist will draw on multiple approaches to help an individual's needs. Really, it's about creating that real personalized plan for you, using all of the experience to interweave between the different modalities. Unless, of course, it's a specialised approach like EMDR, which we spoke about before. Although some therapists do both. So it's always worth checking. Integrative therapy is all about flexibility. So for example, how I will interweave it is we'll do a little bit of CBT. We can look at those thoughts that are cropping up, but then we might move into psychodynamic to help you explore the past and how those conditions are showing up. And as I've mentioned, there's the humanistic, which is person-centered, which is the conversational. So sessions can be really flexible. So an integrative therapist is really useful if you want access to the different types of modality. And a lot of therapists do offer those different approaches, but I wouldn't expect you to be telling them which approach would be suitable for which session. They will talk to you about that and explain which modality they think might be worth exploring with you. And next we've got DBT, dialectical behaviour therapy. And the real focus of DBT is to help you really manage intense emotions. DBT really promotes and helps you to understand and accept feelings, but it also gives you some practical skills to help you manage those intense emotions effectively. It's a really comprehensive approach that not only supports emotional regulation, but it really encourages positive changes within your life. I hope that really helps you to reflect on your needs and consider which therapy might be best for you. Have a listen again, have a think about what you think really would be suitable for you, and reach out to a therapist and ask them which modalities do they use, what's their approach. And as you can see, each has its very own unique approach and benefits. So whether you're dealing with anxiety, wanting personal growth, or processing trauma, there is definitely a type of therapy that can help you. So I really encourage you to reflect on those that I've shared and consider reaching out for support if you need it. Taking that first step into therapy can feel really overwhelming. And it feels uncomfortable, but it's the sign of growth. We're wanting change. We don't want to feel uncomfortable anymore. We can feel that things are getting in our way. We can feel that heavy backpack and we want to unpack it. And hopefully this has given you hope that there are so many different ways that you can do that. Not just the therapist lying on the chaise lounge with the glasses on and a clipboard. That's generally what people think when they're going into therapy. So I just hope that this has helped you to understand there are so many beautiful things out there available to you. Those of you that follow me will know on my website there is a bunch of free resources. So head to jerrycarey.com and have a look at the free downloads. There's ebooks there that will help you along the way to do some work outside of sessions or help you to get going with your own journey of self-awareness. Thank you so much for joining me today. I hope you found this useful. I've really enjoyed sharing this information and I will look forward to speaking to you next week. Take care.